Good afternoon, everyone. I see there's a couple of folks still trickling on, but I'll go ahead and kick us off because we have a full panel today, and I don't want to keep one more minute from you. My name is Liz Charnitsky. I'm going to be moderating today's NNECTR Spring Seminar Series. I'm a faculty scientist at Maine Health and pleased to be with you. So for today, a couple of housekeeping items. If you could please make sure that your mic is muted when you are not speaking, that would be wonderful to keep kind of background noise to a minimum. And we will have a Q&A session today. So if you could hold your questions for the Q&A session, that would be wonderful. But we are so pleased for today's topic, sustainability, health, and health equity in rural areas, needs and opportunities, which will involve a really robust panel discussion. I'm going to introduce right now our moderator, Dr. Christine Vatovec, and she will introduce each of the panelists as they speak. So Dr. Vatovec is an environmental health social scientist who studies the interconnections between human health and planetary health and serves as the Planetary Health Lead at the University of Vermont OSHER Center for Integrative Health. At UVM, Dr. Vatovec is a research assistant professor in the Larner College of Medicine, a fellow in the Gund Institute for Environment, and lecturer in both the College of Nursing and Health Sciences and the Rubenstein School of Environment and Natural Resources. Thank you for joining us here today, Dr. Vatovec. I'll turn it to you.
Thank you so much for the introduction, Dr. Charnitsky, and thanks to NNECTR for inviting this panel. I'm very excited to be here with you all and to be able to help bring some of the really amazing work that's happening here around Vermont, really. Let me make sure that, are you able to see my slides right now? Perfect, excellent, okay. So we do have a full panel. I'm not going to say too much other than the way that the flow will be today is that you see the list of panelists here, and they know ahead of time that because it's a tight time turnaround, I will be advancing slides for us. And when we have a minute left, I'll send the panelists a 1-minute warning in the chat so that they see that. And then if the minute is up and time is up and ready for the next person, I'm just going to advance the slide to the next person. So that'll just be our way of moving forward, making sure that everyone has time to speak. So without further ado, I just wanted to place this conversation, right? We're talking about current efforts, projects, and potential collaborations around sustainability, health, health equity, health care. And I wanted to put it within this context of the current planetary health initiative that the University of Vermont Provost Patty Prelock has put into place with support from faculty from across the institution. And so these two different terms, sustainability and planetary health, are very much hand in hand. And really what we're thinking about is what are the things that we can be doing as an institution that will help improve and enhance the flourishing for both people and the natural environment, the planet. And so today, our purpose for this panel, all sharing the different work that they're doing, is to provide this range of projects that are ongoing, things that these folks are thinking about, and to share this with our healthcare research community, specifically with the intention of identifying new opportunities for collaboration, and at the minimum, keeping everybody up to speed with some of the things that is happening. So we're going to start off with David Grass, who is the Senior Environmental Health Program Manager at the Department of Health, and one of his areas of expertise is in leading the Climate and Health Program. And David, I'm going to turn it to you. David does not have slides, so I'm going to actually stop sharing my screen and you can take it away.
All right, wonderful. Can you hear me okay?
Yes.
All right, thanks so much for the opportunity. My name is David Grass. I work in the Division of Environmental Health at the Vermont Department of Health. One of the programs, as Christine said, that I oversee is the Climate and Health Program, which is a CDC-funded program. There are 9 states that receive the Climate and Health Grant, so we count ourselves lucky to be among them. It's not a large grant. It funds 1.3 full-time employees, and so you can imagine for a problem the scope of climate change, which has been called the largest public health challenge of the 21st century. It is a challenge to try to tackle with 1.3 FTE. And so we have to be very creative in our collaborations and partnerships to try to enlarge the footprint of our program and do the most that we can. I thought the best way that I could summarize some of that work would be to try to give you a snapshot of a day in the life of the Climate and Health program through the lens of some of the different staff. And I pasted into the chat some links that are illustrative of some of the work that these staff are doing. So I'm going to start off by talking about Isaac Daniloff, who graduated from Middlebury College in 2022. Isaac's senior capstone project in environmental studies was a group project that was done in conjunction with the health department with the goal of understanding the experience of unhoused Vermonters during hot weather events. And the Middlebury student group interviewed dozens of unhoused Vermonters and service providers in order to be able to better understand their needs, such as access to air-conditioned public spaces that are free of stigma, drinking water, access to drinking water, sun protection, hygiene support. And in the project outputs, the students took what I would suggest is a pretty novel approach of trying to allow the voice of their interviewees to really speak for themselves through direct quotes and audio recordings. And after Isaac graduated, he came to work for the health department for a year in order to wrap this project up by building a storytelling website that uses audio clips in order to inform the public and policymakers about the specific needs of people who are unhoused in response to the dangers of hot weather. Isaac, so that website should be coming out in the next couple of weeks, hopefully. While Isaac worked for us, he also single-handedly doubled the number of publicly accessible cooling sites that are listed on the health department's cooling site map, which is one of the links that I pasted in, which was of tremendous value to the health department. He did that by getting onto the phone with people in literally every town in Vermont. So I'm very grateful to him for that work. On Monday, to wrap up his work, Isaac and others will be presenting the results of their efforts to a group of shelter directors, and they'll be joined by colleagues from the Department for Children and Families, who will help describe to shelter directors and street outreach teams how they can provide personal hot weather resources to their clients using DCF funding. And the project's recommendations will also be highlighted in the health department's heat season press release later this summer. So compelling that it works its way into policy, and it's really been exciting for me to be kind of adjacent to this project as that has taken place. I've also included a link to a new resource from the CDC, the heat risk tool, which includes great specific guidance for healthcare professionals. I include it because I find it a lot more accessible than the National Weather Service, like heat advisories and heat warnings. It talks about heat risk in terms of being like minor, major, or extreme, and it uses the same color scheme that the EPA uses for air quality index warnings. So for me, it's a little bit easier to interpret, and I think it's a good resource to have on hand. Also joining the health department's climate and health program this summer as interns are Jing Fu from the Yale School of Public Health, and Jing will be assessing the feasibility of putting temperature sensors into the homes of high-risk individuals with automated temperature alerts being sent to caregivers such as visiting nurses or meal delivery volunteers. Jing will be working in collaboration with Fasayo Ogumbayo, who's a physician and MPH student from the University of Illinois, Springfield. Fasayo will be looking to interview caregivers to learn more broadly about how they're supporting the heat safety needs of their client population, and in order to identify unmet needs that could benefit from programmatic intervention. The next character in the cast of characters is Lauren Prinzing, who is a health department epidemiologist who works part-time for the Climate and Health program. And Lauren's supporting a weatherization and health initiative that makes use of funds from the Vermont Department of Public Service to work with clinicians in the UVM MC network and the Northeastern Vermont Regional Hospital to offer home weatherization plus health services to families with children with poorly controlled asthma. So you probably all have a sense of what home weatherization is. Home weatherization plus health includes additional services such as replacing carpets, identifying moisture problems, and implementing solutions to remedy moisture problems or pest management issues. The project aims to evaluate the impact of home weatherization plus health services on healthcare utilization and healthcare spending for these families. Next is Jared Ulmer, who manages the Climate and Health Program. And Jared, in addition to being the ringleader who pulls together all of the staff who I've already mentioned, supports the health department's input into state efforts like the Climate Council, and bringing additional resources to bear for climate and health through grants from FEMA and EPA. And this morning, Jared, along with other colleagues, presented to a group of 40 school administrators on how they can prepare their schools for hot weather. It's a collaboration with Agency of Education, and it's informed by work that Professor Vatovec students did last year. To wrap up, my role within the program is basically to try to push the work of climate health, impact assessment, and adaptation into other divisions and operational units across the health department. So we don't want to be just one program within a silo with limited reach. We want to push the work of doing climate adaptation across the health department. And so one way that I've been doing that is through the health department strategic plan, and I'll paste the link to that into the chat as well. Along with a couple links to pollen monitoring efforts, which are related to climate and asthma and allergies. And that's been a passion project of mine in order to continue the ability for pollen data to be collected in Vermont when there's no dedicated funding in order to be able to do so. And if you're interested in pollen, please reach out to me. All right, I think that's my time, so I will stop there.
Excellent. Thanks so much, David. I know you could speak to us for days and days about all the programming you have, so thank you for keeping it short. And I'm going to pass it now to Dr. Elizabeth Doran, who is a research assistant professor at the College of Engineering and Mathematical Sciences and does a lot of work with heat and heat mapping. So without further ado, over to Dr. Doran.
Thanks, Christine. It's a pleasure to be here. And yeah, I've been working for the past couple of years to establish a research program around heat and climate resilience in Vermont, and really thinking about small cities and rural communities, which are left out of what we understand about particularly urban heat, the exacerbation of our experience of climate. But nevertheless may be relatively significant, which is what our research is showing. So over the next couple of minutes, I could also talk all day, but I wanted to kind of give you a little bit of a map of what we've been up to the last couple of years and a couple of future directions. So super quick acknowledgement. This has been a huge effort with lots of students, including undergraduates and graduate students, and collaborations across the state, including with local community leaders, state health department. You just heard about Jared Ulmer. He's been a huge resource. And just to motivate this, if you can go to the next slide. 3 in 10 Americans live in what we consider to be small communities, nevertheless urban by the definition established by the Census Bureau. So those are communities with less than 50,000 people, which is all of the communities in Vermont. And yet some of our other research is showing that like huge variations in heat exposure in particular can exist in communities at relatively high or small scales. So one neighborhood or one block is not very hot and the next block over is much, much hotter. So we've been trying to establish the evidence base for considering small and medium-sized cities and rural communities within the larger system, because where we know there's a problem, money is more likely to flow. So we really need to establish that this is a problem not just in the mega cities, and then obviously maybe different strategies come into play for how we address it. So there's obviously, I've underlined and bolded all of the thermal comfort and kind of human health implications of this research, but we have implications that range from water quality to energy use to kind of the feedback systems to climate change as well. So we had some funding from NOAA, and we collected data both from the general population about the human system and how people were responding to this threat, but we also did a comprehensive evaluation of the physical system. So we went to 9 cities and towns with a team of undergraduates and graduate students and mapped the heat signatures in each of those communities, which varied in size and kind of different geographies. And then we did a bunch of analysis. And Christine, if you want to like just move down to slide 7 really quickly, I can kind of move us around this. So system map. So in the center of this research program, we wanted to understand the magnitude and distribution of our heat and who and what was potentially driving it within the built environment. Then we also wanted to kind of move into who was living in those places that were more exposed and what were the environmental justice concerns that might be apparent. And then if those are the same people that have the adaptive capacity to change their behavior, change their environment, do the weatherization, and then what were the systematic implications or potential interventions that we could start to think about. So we have research and results kind of in all of these different areas. We are using behavioral theories to understand human behavior in terms of individual action, collective action, and broader system implications of those behaviors, as well as interviewing people like the public works director to understand whether or not they even know about alternative materials that they could be using in our built environment. And I'm really excited, if you want to switch to the last slide here, I've bolded a bunch of the human health components here around kind of the adaptive capacity and human behavior, open research questions that I'm really interested in. Schools and senior housing, cooling center accessibility, just messaging about interventions, but also policy analysis and how we can support multi-hazard risk communication, things like that. I think that there are a number of really exciting kind of research directions, and I'm really excited for kind of the conversation that's going to happen after we all introduce ourselves about some of those directions and what folks on this call are seeing in their populations and in their professional experiences. So I might actually leave it there, and I look forward to further conversation after the rest of the talks.
All set? Hello, everybody. I'm Diane Imrie. I'm the Network Director of Sustainability at the Health Network. The network is 6 hospitals and home health and hospice. You can go to the next slide, Christine. So my intention today is really just to describe to you a little bit about what's happening in healthcare and why. So I'll just touch briefly on the why as it relates to healthcare as a system. So obviously we know the health crisis, healthcare is a top polluter. So I think 8.5% of pollution is created by healthcare. Our regulatory landscape is changing. So this work is coming down the pike in terms of regulatory requirements. And we have a lot of people in our world that really care about it. Next slide. So we're not alone in this work. UVM Medical Center specifically is part of U.S. Healthcare Climate Council, and these are leading systems in climate work, and we're lucky to count ourselves among them. And the best benefit from this is that we really don't have to create very many solutions from scratch. When we put all of our resources together, there's a lot that we can just adopt. Next. So what is the work? So these are kind of the buckets that I think about in terms of sustainability in healthcare. Some of them are obvious, except to say none of them are easy. So there's work literally in everywhere that you can be touching in a healthcare system. The big ones for us this year that we're focused on are energy, green purchasing, transportation are the ones that, and the OR, of course, are the ones that are popping up as our major components of work. Next slide. So where are we going with this work? So we have our first strategic plan. We've never had one of, we've never actually had a plan for sustainability until this year. So this is a strategic plan for the network. And so 4 components of our pillar under stewardship. So mitigation, obviously just reducing our footprint. Highlights there are to create, well, first track where we are. So we've never done scope 1 and scope 2 emissions tracking as a network before, and then creating a long-term energy project and plan, looking at our transportation everywhere across the organization. Those are our biggest ones, and single-use device, big opportunities for both savings and impact. And then the resilience strategy, I think, is a newer piece of work for the country, actually. And that's just thinking about, as weather-related emergencies arise, what does our patient population expect from us? What do our patients expect? Are we prepared to play different roles in the future? And then the leadership strategy is just to continue our leadership. UVM Medical Center has been a top 25 green hospital for 10 years plus. And so thinking about how do we continue that leadership and influence the industry. And then just making sure that we have a workforce engagement strategy, because this is important work for all of us. Next slide. So the why. So climate smart healthcare really is cost effective in so many ways. It's good patient care. My recent experience with physicians and others is that it's really an antidote to burnout. People really do want to do this work, and it's a good recruiting tool. Our new caregivers are expecting us to be working in a very positive, environmentally focused organization. Regardless of whether we want to or not, we have to be prepared. That's our role in the community. And then I'm reaching out to others across the organization just to learn what role people will play. So I'm interested in leaving a lot of time for discussion today to hear what people's roles are and what you expect. What part can we all play?
Wow. Awesome to be here. I'm learning so much and getting so many resources from all the presentations. My name's Andy. I use he, him pronouns. I work, so my work is largely clinical, working with youth and families at our child psychiatry clinic at the UVM Medical Center. And then a lot of educational stuff, teaching trainees and learners at varying stages. So I thought I would walk through just thinking about mental health in this context, in this day and age, and borrowing here from the citation of Norm Sartorius, who is a Croatian German psychiatrist and professor and mentor to many. And if you click through the animation, so he and his colleagues define mental health here as a dynamic state of internal equilibrium that enables individuals to use their abilities in harmony with universal values of society. The italics there are mine, because the question comes up, what do they mean by universal values? And their definition includes respect and care for oneself. And again, my italics here to highlight the sort of planetary sustainability connection and other living beings, recognition of connectedness between people, respect for the environment, one's own and others' freedom. So in this perspective on mental health, it's integrally connected to planetary health and sustainability. So what can we do about this? And I'm thinking kind of like in the office, the exam room, the consultation room, meeting with a patient or family member, how do we start to pair planetary health with human health and the clinical interaction? How do we support clinicians in doing this? How do we study the impact of what we're doing? So starting small and working together, I think, is part of what all these projects, though they've had some big outcomes and findings and impact, they all involve teams and individuals and communities. So I'm listing 3 projects here. I'll briefly talk about them, and then I'm going to ask you to vote to rank them as to which seems the most feasible and useful to move forward with. So the first are planetary telehealth guidelines, then PlanetRx prescribing in a planetary friendly way, and then last, a planetary health review of systems. So do 1 slide for each, and then turn it back to you to rate them. So planetary telehealth guidelines is about what it sounds like. So thinking about something like the carbon footprint when we make decisions about where and how to meet with patients and families. So you can just sort of keep clicking, Christine. Probably put too many animations for a shared presentation. So the underlying question is, do we meet in person or via telehealth? That might be a consideration. How do we work in different clinical settings? But to try and overlay sustainability and ecology on that question and to balance it with factors that might involve equity, access to care, transportation, as well as what are the planetary effects? How do we help people to decide what's the impact of driving to this appointment where something in person might be valuable? Is it necessary? If there is driving involved or other transportation, how do we account for the impact? Are there times we can lean into telehealth that would reduce carbon emissions and be good for the planet? So I haven't come across many guidelines for when to use telehealth, at least in the field of psychiatry and family psychiatry, let alone how to think about it in a sustainable fashion. So number 2 is PlanetRx. So this would be thinking about what would it mean to prescribe for the planet. And often we think of prescriptions like this illustration, colorful assortment of pills and tablets. But what about integrative interventions, by which I mean whole health, nutrition, food as medicine, nature as medicine, movement as medicine, spirituality? How do we think about conveying the science behind these evidence-based mechanisms alongside what pills and prescriptions we have? This sometimes falls under lifestyle medicine or integrative medicine. But thinking about planetary medicine, how do we incorporate and illustrate and educate both clinicians and patients and caregivers about the impact of these choices, not only from a carbon footprint of what it takes to produce these pills, some of which may not be necessary all the time, but also the pollution of these things getting into the air, the water, our food sources, and doing it in a way that's accessible for clinicians and patients and doesn't require a whole separate appointment. So I'm thinking, could this be a little prescription card? Is it a QR code they can go to? Is it something we can say in the clinical interaction to invite this into the conversation? Which segues into the third possibility or project, which is the review of systems or symptoms is something that's already part of the standard medical interview and assessment, where after gathering information on the target problem. So say somebody comes in with asthma, breathing difficulties, the review of systems is to say, okay, what about your heart? What about your GI system? What about your nervous system? What about the other systems in the body that might impact that, or maybe we're missing something? So how can we take what already exists, the review of systems, and weave some sustainability thinking into that? A sample script might be asking, in this review of systems, do you have exposure to smoke or fumes in your life from fires, wildfires, cigarettes, or cannabis products, vehicle exhaust? So getting some ideas into the conversation that would help people to think about, how is this affecting my personal health by thinking about the air and the environment around me, or potentially natural disasters. Click 1 or 2 more. And this affects not only well-being, but pulmonary health, allergies, substance use, et cetera. So how could we expand on teaching clinicians to weave some of this in as we're asking about human systems, the connection with planetary systems? So last slide. In the waning seconds, if you're willing to put in the chat a 1, a 2, or 3, what gets your vote for which seems like the most high yield to pursue? And I put some additional questions here, but just thinking about how would we measure success? Is it related to the carbon footprint in my field of psychiatric medications or some sort of pollution quotient? How do we think about medications that might be overprescribed in certain marginalized or underrepresented populations? So with any of these themes. So I'll stop there, and thanks for the votes in the chat. I'll tally those while we hear from our next speaker.
Hi, everyone. I'm Chelly. I'm a rising fourth-year medical student at the Lerner College of Medicine at UVM. And I've sort of tried to engage in planetary health work since I started med school. I guess just to start with like an overview of how planetary health is covered in medical school at LCOM, there is some mention in the preclinical curriculum on planetary health topics throughout different sessions on respiratory health, infectious disease. These topics are sometimes like mentioned in a slide or two, but there's no dedicated teaching on climate and health in the preclinical curriculum. There is some dedicated time to discussing climate and health in Social Medicine Theme of the Week, which is an initiative through the Lerner College of Medicine's Social Justice Coalition, where students will present on a social medicine related topic at the beginning of a class. And then there is a dedicated climate and health session in the third year Global Health Bridge Week, with the first of that session being given this past year to the class of 2025. And then there is an optional fourth year elective course, Ecosystem Change and Human Health, that's offered to about 20 students per year. So I think we've heard from a lot of other speakers about the ways that people in our communities are affected by climate factors. And a lot of being a doctor, and also a lot of what we learn in medical school, is building a differential diagnosis based on presenting signs and symptoms of a patient. But a lot of that is also based on the risk factors that are affecting our specific patients. And like a lot of the people have mentioned, climate is a very large factor that's affecting our patient populations. And so we should have climate on our minds when we're thinking about building a differential diagnosis. And so I think it's very important to include teaching on this in medical school. But it really isn't a huge topic. There are some advocacy and outreach opportunities through the school. The public health projects are something that all medical students engage in at the end of their first year and beginning of their second year. And there have been projects in the past that have partnered with community organizations in Vermont that focus on climate and health. There was an educational retreat that the school hosted that featured a climate, someone interested in the intersection between climate and health as a keynote speaker. And there are some community service partnerships, especially through the Environmental Health SIG, which didn't exist when I started medical school. So me and some other interested students started that, and we've partnered with the Vermont Climate Health Alliance and been able to engage with them and focus on outreach through op-eds and video filming for the community. And then the Planetary Health Report Card is the next thing I wanted to talk about, which is sort of a way that we as medical students have been able to assess the ways that the school integrates climate and health into the curriculum and into opportunities available for medical students. So this is like a global initiative that was started by students at UCSF. And it creates this tool that anyone in a health professional school can use to evaluate the ways that their school adheres to different criteria that surround planetary health. So curriculum, research, institutional support, community outreach, and sustainability. And so a group of students here at LCOM participated in this to evaluate our school. And we found that the topic areas that were that graded the highest were interdisciplinary research and campus sustainability. A lot of that was due to initiatives at UVM as a whole, not specifically LCOM, but that UVM or that LCOM students have opportunities to engage in. And then areas that needed more improvement were the planetary health curriculum and support for student-led initiatives. So as like a student at LCOM, I did find that there were a lot of opportunities that I could engage in planetary health if I sought it out, but there wasn't necessarily a lot of external support or advertised opportunities for me to get engaged as someone who didn't already know what resources were available to me. And our plan is to continue working on this planetary health report card from year to year to monitor how our medical school improves in these areas. I think what I've realized from kind of working in this area for a few years is that it's not that there's like a lack of interest in integrating this stuff into medical education. It's more that there is so much that we need to learn throughout our medical education, and it takes a lot of time and energy to integrate this stuff into an already packed curriculum. And so it really does take continued efforts at pushing for more inclusion of this and a lot of lift on the part of the people who are interested to get this added to our to what we engage in medical school. So opportunities that I have seen both through engaging in this stuff on my own and through completing the planetary health report card was that there are so many opportunities to integrate planetary health into the preclinical curriculum. And there's specific courses that LCOM offers that are great opportunities to do so. But as I said, it can be difficult to find areas that can accommodate the curriculum without taking away from the other areas that we need to learn. There also can be increased support for students interested in planetary health through advertised research projects and mentorship with faculty both in medicine and outside of medicine. UVM also has a lot of resources focused on planetary health and increasing partnerships and making sure that medical students are aware of the resources outside of LCOM but still at UVM can really help us become engaged and make those partnerships. And then there are also so many local, state, and university organizations that focus on planetary health, and increasing the collaboration between medical students and these organizations can increase students' accessibility to learning and working on planetary health initiatives.
Can I just say, amazing job, speakers. You got us there in the time that we were hoping for. Thank you all for sharing your thoughts briefly with us. So just to kind of group us back together again, we've gone from the big picture of the state level with David's work, looking at public health aspects of heat with Elizabeth, taking a step into the actual healthcare network with Diane, and looking at all of the amazing work that has been done through the sustainability approaches of our health network, and then more specifically into medical care itself, that patient-provider interface that Andy is discussing, and now into the actual training of our students, our future healthcare providers. So we've tried to give a nice, big, rounded approach to thinking about sustainability, planetary health, health equity across all these different pieces within the state of Vermont and within Northern New England. And since we do have time, I'm going to share very briefly a new project that we're in the very final phases of getting funding for this. This is a joint catalyst research funding opportunity between NNECTR and the Gun Institute. And we're in the final phase. It looks like we will be able to get the go-ahead to begin in June. So we'll be reaching out to this community again to try to understand what is the current state of climate-informed healthcare across Northern New England. We'll be doing a survey of residents, which will be very much in line with what David and Elizabeth are speaking about, right? That public health piece. What is the experience of climate change that people on the ground in Vermont, New Hampshire, and Maine are actually dealing with? And then surveying and interviewing physicians in primary care to understand how are they responding to and preparing for and helping their patients within this realm of climate-related health challenges. And then working on developing some future tools to make sure that we have a region-specific number of tools for our primary care providers. So that's a project I wanted to just highlight of something that will be coming in the future as well. And now opening it up for discussion. It looks like we have about 20 minutes for discussion, which is great. And just to get things started, here are a few questions for you all to consider. First, what questions do you have for the panel? We'll open it up to anyone who has a question. You can either raise your hand in your video or raise your hand, put something in the chat as well. But we're also curious to hear from you across this broader perspective of, going from state and public health all the way down to healthcare. Where are you seeing these connections within the audience? Where do you see specific patient populations that are needing support? What are some of those research opportunities that could really help move things forward? And how might we use this momentum that we have here with all these people that are working on this? And this is just a selection of folks who are in this area. How do we use this to really improve health and well-being for both people and planet? And I will stop sharing. And I see Cameron, you have your hand up.
Thanks, Christine, and thank you, panel. That was a great overview. I'm really struck by the comment that Brenda Lau put in the chat, and I was thinking the same thing. I think it's a wonderful set of piecemeal actions that, frankly, are going to have piecemeal results. That's not to criticize them. They're all important. I've been working in climate change for 30 years. I know it's a real difficult challenge. But I guess my question is, how do we begin to lay the foundation for this to be fully integrated? So when you think about the planetary health perspective, it's not health with climate or sustainability tacked around the outside, which is how at best it is today, and at worst it's not considered at all. How do we really integrate the two going forward, especially with the challenge that especially for our students, their curriculum is already so full, and the people teaching the courses probably don't have the expertise to do this.
I really appreciate that question, Cameron, and I appreciate the comment from Brenda, who is a dear colleague of mine in the OSHER Collaborative out in Washington, actually joining us today. I think, this is a great question. Curious to hand it over to the panel in terms of what are you thinking about this need for the paradigm shift so that we aren't just chipping away at these little pieces here and there that are all important and build towards something, but how do we hit that consciousness piece where we are all seeing ourselves as a part of this planet in a different way? I'm seeing lots of smiles. Shelley, what do you have to say?
I definitely appreciate that sentiment. I think that's kind of why, for me, building this into medical education has been so important, because a lot of action comes from just learning about these topics and getting people engaged. I remember hearing a talk in med school that was saying that doctors are like the least engaged in advocacy out of any like professional group. And I think people tend to really respect what medical professionals have to say. So part of why I see incorporating planetary health into medical education as so important is getting more physicians and other medical professionals engaged in advocacy for larger paradigm shifts. And I think with more engagement in this group of people, there is that opportunity.
Thank you, Shelley. I'm curious to hear what people think about just changing also the way that we define health within the healthcare system. And that within our westernized approaches, we've been trained collectively as a culture to think about going to your doctor to help you when you have some physical challenge that's happening to you, and it's broken down into that, organ systems and that, and those things are starting to change. With the OSHER Center for Integrative Health, the OSHER Collaborative, there's a big push towards redefining health really in this whole person approach. Like people, we're not just in organ systems working together. We are human beings that have a physical, mental, social, community connections, and we want health within all of those different systems, and that connects to the planet. Curious what other people on the panel or on the call would have to say about redefining health as a way to get to that connection between the human and the planet.
Hi, this is Dr. Heather Sharkey. I don't want to sound like I'm on a soapbox or anything, but I'm an osteopathic physician, and the osteopathic philosophy and training encompasses this. It always has. The 4 tenets of osteopathic medicine are that a human is a whole, a mind, a body, a spirit, and all of the systems, the body systems, all work together and are integrated together. And structure and function are interrelated, and we're self-healing. And we use those topics to take care of people. So the osteopathic training has been has included the occupational health and environmental situations for a very long time. So this feels very familiar and at home for me. I think one of the struggles other practices, other professions might have is that it's hard to screen for something without having a solution. So you can diagnose your patient with asthma because of an environmental exposure, because of the pollution in their area. What do you do about it? So the thing we know to do about it is to give them the inhalers and medications. So that might be some of the hesitation with physicians screening for these things, because they feel like they can't change it. They might also hesitate to advocate because we take care of everyone, and we take care of people who may or may not agree with some of the things we agree with politically. And so putting ourselves out there with a very strong stance about something, I think, is scary for a lot of people. Not for me, my patients aren't scared of me as much as they should be, but those are some of my thoughts.
Thank you, Dr. Sharkey. Really appreciate that different perspective as well. Andy, I'm curious if you have anything to add here.
Yeah, I really appreciate what you said also about osteopathic and other non-Western approaches. And I think Cameron's question, it's just, I'm sort of just sitting here reeling in it because so important, and it's so many levels of system change from the political and sort of economic, capitalist and Westernized medicine, and the way we practice this sort of individualistic fee-for-service system. So there's so many different levels. And I think when we take topics at that level and try to integrate them, I'm not sure whether a piecemeal solution versus sea change is effective. The end goal is to change things, but whether we get through revolution or through small steps, because it affects so many systems, it's hard to imagine in this political period of revolutionary approach where we sort of all get everybody to turn the tide and just see integrated, whole human, holistic, planetary, equitable health as the goal. I think an advantage of maybe the challenges in that individualistic system that we have now, it's not systemic, but it is a system, I guess, is that we can sometimes integrate it in what is still a really generally respected position of clinicians, physicians, and other healing professions without getting into the political turmoil. We can try to do that. And it made me think about the right to bear arms, guns, and firearms, and how if we focus on safety, then we can talk about making people safer and not talk about taking away people's rights or firearms. And I think we have an opportunity to do that, at least in a taking a very large ship and starting to turn it by talking about the physical, mental, whole health implications of planetary changes, and that people will recognize that and resonate it more often without it getting their defenses up or becoming a politicized conversation, which is not easy to do, but I think it's a nice middle spot that might take advantage of where we're at and moving toward where we want to be. And I saw your comment, Heather, too, which I thought was really appropriate about where do these questions belong? Is this really review of systems, or is it in the social history? And I think I felt like it's a fair question. And that's part of where I'm thinking, can we embed this in the medical review of systems? Not like, certainly I feel in so many ways, including as a psychiatrist, that like the social, it can't be separated, but our system does separate bio, psychosocial, spiritual, all those things artificially. If we can move this toward what people think of as biological, even though that's maybe is artificial, it might get a little more grasp in medical school curricula and policies and things, rather than saying, well, if it's social, maybe it's not the domain of our medical system. Knowing that that's a distinction that I don't buy into, but maybe harnessing the power of our medical terminology to elevate things a little bit.
Thank you, Andy. I see Katie's hand and Gary.
Hi, nice to meet everyone. I'm Katie Wells. I'm an ER physician, but I'm also the director of social medicine at the College of Medicine. And I just want to say thank you so much for this panel today. This was amazing. And two hats that I wear. One is an emergency physician. This is something where I would like to see emergency medicine docs engaged a little bit more in this space. We have a couple of folks in our department that are very interested in this area. Particularly, many of us work in the humanitarian aid space in the international setting. And so are there opportunities for us here at UVM or across this network in Northern New England to discuss planetary health as it's impacting the humanitarian health crisis that we're seeing really worldwide? I do a lot of work here closely with our refugee and immigrant community, and we're seeing mass migration to Vermont. And I'm not sure how many people know that or understand that. A lot of these are coming from areas impacted by famine, impacted by war and conflict. And so are there opportunities for us to engage together, thinking about climate change and the humanitarian impact? And I'm sorry if that was discussed in the earlier part of the panel. I was having some connectivity issues. The other piece is I would love to think about how to get this more integrated into our curriculum. I think, as was mentioned by a person on this call, is that a lot of the people that are very passionate about this are not necessarily experts in this area. And so I just want to open this up to folks on this call. If you have curriculum that has been successful, if you're interested in collaborating with us at the College of Medicine to build this out more, I would welcome that collaboration and would love to chat with you and see how we can build that out further. As I think I mentioned in the chat, we're working to build a more dedicated social medicine curriculum. And while we certainly can't cover all of climate change and health in that, I'm thinking about ways to do that more longitudinally. So would love to partner with anyone interested.
Great. Thank you, Katie. I will definitely follow up with you. We have a planetary health curriculum committee in the OSHER Center, and we will definitely be happy to work with you. And I see, Elizabeth, did you have a response to that?
I did just want to mention that part of the changing paradigm systems are quite dynamic, as we all know, and their dynamics can change rapidly. One of the things that we're trying to do in my research is expand the stakeholder communities that are involved and that we're bringing to the table. So I mentioned that we've been interviewing public works directors, so people who make decisions about where pavement goes. They don't necessarily think about themselves as having any impact on public health, but in the context of the built environment and its impact on our well-being, they really are kind of making decisions that are connected to outcomes that we're seeing, particularly in the context of changing climate conditions. And so just thinking about that in my own work, that is one way that we're trying to just be thinking really creatively about who's at the table and what their role is, and waking them up to the fact that their decisions are, in fact, part of this conversation if they don't think that they are. before we have that conversation.
Thank you.
And I'm
Elizabeth.
really excited about all the other things that I'm hearing and writing names down to follow up.
Absolutely. Raju, I see your hand is up.
Hi everyone, I'm Raju Badaredi. I'm an environmental engineer at UVM. Again, I just want to share my thoughts. It's very exciting conversations that I'm hearing, and I've been thinking a lot about planetary health and human health and so on. And being an environmental engineer, I want to share some thoughts that I'm having right now. So people health or human health is the way it is right now. It's because of what they are eating, what they are thinking, and what they are breathing. There are environmental factors, and that is kind of also linked to the human behavior. And if we can address the human health, that will naturally kind of fix the planetary health, because human is the dominating factor on the planet, and rapidly, dynamically changing all the environmental conditions. So, the solutions that we are developing, I think it has to be at the individual level. If a single person can change, if that, change in the attitude, in the mental, physical, and emotional, if that change comes in a single individual, that individual can be a force to bring a change around him or her, in the environment, and that change will spread. But if I don't think, in my opinion, on a larger scale, if we cannot bring a change, but if who is the society? The individual is the society. And if that, if that change can be brought about, think about the sustainability at the individual level, then we can, that effect will gets catalyzed, and it will be brought to the planetary scale. Again, see, like, we are talking about the medicines and fixing all this, but for example, the medicines that work for a person in the United States may not work for the person for the same disease in India, because totally different culture, totally different environment, totally different thinking and all. So we have to kind of consider all that. And if we, without considering these factors, that's what I'm kind of thinking, the holistic health and planetary health, but it has to begin at the individual level. And if we can focus our efforts, it's each one of us can come together, collaboratively think of new approaches, that not burdening the individual, but bringing about the change, then we have some hope to reach into the planetary health, but it has to begin at the individual health.
Thank you, Raju. I really appreciate your comments. And I think I'm right there at the same place that you're thinking with, where I'm driven from is the idea that if each human were really truly healthy, spiritually, mentally, physically, socially, if we were healthy, we would not have planetary health impact, because we would not be in this consumptive state where we are just pulling this transactional relationship with nature, taking from the earth. We would be considering ourselves as part of the earth. So I very much appreciate that comment. And David, I see your hand is up too.
I wanted to respond to the incrementalism versus, whole scale change. I experience similar frustration, sometimes feeling like we have to move mountains, but observing that we're sort of moving small rocks instead. We made some big change this last summer after the flooding, after the wildfire smoke, where initiatives that we were trying to push through previously, and we couldn't, we succeeded essentially to get leadership to take those proposals seriously, because it was so evident the way climate was impacting population health. So that's sort of, a hopeful note. The cautionary tale there is, if we're making change in response to disaster, that tends to be very reactionary and have negative impacts in terms of health equity and climate justice. Where there are large FEMA responses, it tends to exacerbate socioeconomic disparities. So it's certainly better if we can do this in a proactive and preparatory way than in responding to disaster.
And I think I'll add to that in our last moment here, having a positive outlook, right? Like projecting hope for where we want to be, not running from what we're trying to avoid, but what is the future that we would like to see, and how do we get there in a way that's healthy for all people, all species that we share this planet with, and nature more largely. Gary, your hand went up and down. Do you want the last word, Gary?
No, all I was going to say, it's been touched on, but one of the perspectives with the changes that are taking place in some cases progressively, in some cases dramatically, we have to start thinking of tropical medicine as opposed to what we have been currently thinking about, because there's a lot of signs, symptoms, vectors, and diseases that we are suddenly confronted with.
And very great point. Yes. And thinking proactively again in this way as well, what do we see coming to Vermont, to the northern New England area? Well, we are out of time. I want to thank everybody for joining us. And thanks to, I think, Sheila, I think you posted, yes, next week there will be another seminar. So if anyone needs a last wrap up, feel free to hop on. Otherwise, thank you to our panelists, and thanks for everyone for joining us today.